Hi, I'm Lawrence Bergstrom, osteopath and non-surgical spinal disc decompression specialist. Why does your osteopath have a medical tuning fork in their consulting room? 4 key reasons. Number 1, we can test your hearing and your cranial nerve function within your head. So when we strike the tuning fork, we can place it on the top of your head and behind your ear, and that tests what we call bone conduction. So that's the nerve function which resonates through the bone. Okay, and then if we strike the tuning fork again, we can test air conduction. So this can test your hearing and whether there is a nerve problem or whether there is a blockage. So if we have an air conduction problem, there could be a blockage in the inner ear. If we have a bone conduction problem, then there could be a problem with the nerve. So this is one reason why we have a medical tuning fork. Another reason we have it is for testing your nervous system, because one of the sensations that you have is vibration sense. And when we test peripheral nerves, so for example, we can strike our tuning fork and we can place it on your fingertip or on your toes. If you can't feel it in comparison one side to the other, or it's feeling dull or it's absent, that tells us something about your nervous system, and that would require further follow-up. So that's 2 reasons why we have a medical tuning fork. A third one, which is a surprise to a lot of people, is if we suspect a fracture. So let's say you'd fallen, you were experiencing pain, say in your forearm here. Again, we can strike this, we can place it on the bone, and the vibration as it's conducted through the bone can, in theory, it can cause a degree of vibration at the site of the fracture. Now that will stimulate the site of the fracture, so unfortunately it could be a little bit painful, but it gives us an indication. Now, this is not as specific as an x-ray, of course. So if we suspect you've broken a bone, we're referring you for an x-ray. But this gives us at least a suspicion as to what might be going on. And a 4th reason, which is thankfully very uncommon, but it does occur, is if we suspect serious pathology within your spine. And when I say serious pathology, we're thinking something like a tumour within your spine, okay? It could be benign or it could be more serious. But generally speaking, there'll be other symptoms as well. You'll probably be feeling quite unwell. You'll have pain that's not really resolving. And then we will, what we call palpate. So if it's over your spine, we'll gently press over the spine. We might tap with our fingers, or again, we'll use our tuning fork and put pressure over the area of your spine, which is feeling particularly sore and tender. Now that could resonate into the area, again, be very painful. Again, this is a simple tool. We would back it up with blood tests and of course medical imaging of your spine, but people do ask, they say, is that a tuning fork? And I say, yes it is. And they say, why do you have a tuning fork in your consulting room? So there we are. I hope this has been of interest to you. Thanks for watching.